All right, so in this video, we're going to talk about hemostasis. And so remember that hemostasis, we're just trying to maintain blood volume, okay? So this process comes into play when you damage your blood vessel, okay? And so with this, we've got three primary phases of hemostasis. And so the first one, here's our blood vessel. We're just going to say it gets damaged somehow. Okay, so that's what happens. So we're just going to say we have some sort of damage to the blood vessel. Now, this isn't part of hemostasis, but this is what causes hemostasis to occur. So you've got damage to the blood vessel. Okay, so I want you to imagine, and I'll talk about this in class, and I probably talk about it on the video that goes along with this, the PowerPoint video. But I want you to imagine that you're at home and for whatever reason, for somehow, some way, you have a leak in your house. So one of your pipes starts leaking. Okay, what do you think would be the best thing that you could do? And let's just say that there's a whole bunch of water, so you don't have like a lot of time here before your like apartment's flooded. And so what you will likely do is you will turn the water off. Now, we don't turn the water off when it comes to blood flow, but what we can do is, here's our damage. Okay, but what we can do is we can vasoconstrict, okay? So the first step is what we call vascular spasm. And all we're doing is we're vasoconstricting that area, okay? And so what this does is this increases resistance. And so as a result, when we increase resistance, we decrease flow into that part of the blood vessel. And so it's analogous to we just turn the water off, okay? So before you repair a pipe, like you're going to turn the water off. Like you're not going to try and repair a pipe while the water's on. It's not going to work very well, okay? All right, so then what's next? Well, we've got this big hole in our blood vessel, so we need to do something about that. And I'm going to kind of just, so we have a dividing line here. So what we're going to do now, or what the next thing that's going to happen, and actually before I go any further, what happens is there are chemicals in the vessel that do this. So this is caused by chemicals inside the vessel, okay? So they're normally separated, but when they're released, they cause vasoconstriction. Okay, so then we've got step two is, so we've got this, okay? And let's just say that, again, coming back to your house, let's say you really, really, really need or want to take a shower, but you've got this leak, okay? And you can't wait for the plumber to get there. Let's say you've got a big job interview or you're going out on a date or something, but you need to take a shower. There's nowhere else you can go. It's only at your house. Again, this is a weird analogy, but we're going to go with it. And so what can you do? Well, what you could try and do is to make some sort of temporary patch. And that's exactly what happens. And so here is my little, we're just going to call this my little patch here. And so what this is this is called the platelet plug. Okay, so it's a temporary patch. It's not going to work really well, but it at least is a way to kind of allow blood flow to continue, but you're not losing a lot of blood. So it's kind of this temporary thing. Okay, it'll work so you can take a shower, but it's not going to work for forever. Okay, and basically what happens is there's something called, the way that this happens is you've got something in your blood vessel or in your bloodstream called VWF, von Willebrand factor. I used to think he's German. If I recall correctly, he's Dutch. Okay, so VWF binds to collagen. And then what that does is that increases platelet activation. And then what that does, long story short, platelets become sticky and attract more platelets. Become sticky. And then it's kind of, and they release chemicals that do this. Okay, so we get this platelet plug. But remember, and like I said in the video, and I'll say in class, this is a temporary thing. Okay, so it's a temporary fix. All right, so what can we do to make this all better? Okay, and the problem, or the reason why this is a temporary fix, is it's just kind of sitting there. It's you kind of force something in there, but if pressure gets too high, that platelet plug is going to release. Okay, and so actually what I'm going to do here is we're going to duplicate this. Okay, and so we're going to bring it down here. Okay, so in order for this vessel to be able to heal and everything to be okay, we need to do something to it. And so what we're going to do is we're going to bind it into place. Okay, and so what's happening is we're going to create this mesh. Okay, and we call this coagulation. Okay, and so coagulation is a process where something called fibrinogen becomes fibrin. Okay, and so I'm just going to write that down here. Fibrin, I don't know where the fibrin. So fibrin turns into fibrinogen. Okay, now in order for this to happen, basically in order for fibrinogen to turn into fibrin, we've got to have several steps. Okay, and what's happening really is that we're taking something called thrombin, and that converts fibrin into fibrinogen. Well, in order for thrombin to do its job, I'm going to move this down a little bit. It actually is inactive, floating around. It's something called prothrombin. So prothrombin is just kind of floating around. It's not doing anything. And so we need to first create thrombin so that thrombin can change change fibrinogen into fibrin. There we go. Okay, we'll do that. Okay, so fibrinogen. Okay, so to recap, we need prothrombin to turn into thrombin, and then thrombin converts fibrinogen, and remember that's one of our plasma proteins, into fibrin. Okay, and so then what fibrin does, it creates a mesh network to hold the plug in place. Okay, in essence, we're calling the plumber and saying, please fix my pipe. Okay, and so when I say mesh, what I'm really talking about is this right here. Okay, that's supposed to be an arrow, and it's a terrible one. Okay, there we go. That's my arrow. All right, and so that plug won't go anywhere. Well, so now comes the question, well, how is that converted into thrombin? And basically what happens is that in the plasma, we have a whole bunch of factors, a whole bunch of just inactive chemicals. And so we've got our intrinsic and we've got our extrinsic pathways. Okay, so intrinsic, extrinsic. Okay, and so with the extrinsic, these factors are in the vessel. And the extrinsic factors are in the plasma. Okay, now in both cases, in order for the factors in the plasma to become active, they have to contact something that's inside the blood vessel. Well, if the blood vessel is not damaged, that's not going to happen. With the extrinsic factors, they're factors that are in the vessel that have to come in contact with something in the bloodstream. But since they're inside the blood vessel, that's not going to happen unless we damage the blood vessel. Okay, and so basically what happens is it's a chain of events, and in both cases, okay? And so there's several pathways, there's several factors. I believe there's 12 of them. And so ultimately what's really interesting is that the extrinsic pathway, you're going to have like 7, activate 8, but it's going to lead to the activation of factor 10, okay? And extrinsic is going to do the same thing. Ultimately, we're going to lead to the activation of factor 10. Okay, factor 10 is the only factor I will ever ask about on an exam. It's the one that is common between the extrinsic and the intrinsic pathway. And so what this does, like I just said, is that we have the common pathway. And the common pathway, go through a couple more steps. Ultimately, we activate, ultimately what this does is this takes prothrombin and converts it into thrombin. And then once we have thrombin, we can form that mesh and we get this mesh network here, and so the plug doesn't go anywhere. As a result, we can increase blood flow. We can start to repair the damaged vessel, but blood flow can continue, and ultimately everything ends up just fine. So the last thing that I want to mention is, well, at some point we need to get rid of this fibrin mesh. Okay, so we've got fibrin, we need to break it. So how do we break fibrin? Well, what happens is we have to create something called plasmin. And so plasmin, oops, if I have the right thing. So plasmin breaks down fibrin. Okay. Well, in order for plasmin is active. Okay. But in our plasma, we just have floating around this thing called plasminogen. Okay. Plasminogen is inactive, doesn't do a whole lot, though it's supposed to be a parenthesis. It doesn't really look like it. Okay. Well, in order for plasminogen to go from its inactive form to its active form, okay, we have to do, we use something called tissue plasminogen activator. Okay. And so all you need to know is that TPA converts plasminogen into plasmin, and then plasmin breaks down fibrin. And then that's when you lose your clot. And so with that is really all you need to know for hemostasis. I know it's a lot, might seem a little overwhelming, but we'll definitely go through this in class.